Hi, my name is Julia Slanina, and I'm the founder and CEO of Treehouse. Our mission is to raise the standard of family healthcare by supporting families, providers, and educating those families while we advocate for a better standard of care for aspiring, expectant, and new parents. Today, I am with Dr. Prati Sharma. She is a reproductive endocrinologist and fertility specialist that practices at Create Fertility Center in Toronto. She is here today to discuss egg freezing. Welcome, Dr. Sharma.
Thank you so much. And thank you for inviting me to speak about this really exciting topic and something that's really come to the forefront for young reproductive age women and couples to really pursue fertility and to have a strong hold on their future reproductive options. So I'm really excited to speak with you today.
Perfect. Well, we're very happy to welcome you. So with that, then let's kind of jump into our first topic for today. We have a few topics that I think are going to be really interesting for our listeners. So let's start kind of from the beginning. How does egg freezing work?
Yeah. So egg freezing is the process by which a woman is stimulated and harvests for her eggs to be frozen for future use. So the whole idea behind egg freezing is that women in this day and age have different missions and avocations. We know that the standard age at which women are conceiving their first child is increasing. It's probably well over 35 now. 10 years ago, it was closer to 30. So women are older when they're conceiving their first child. And we also know that the general reproductive dogma is that the eggs and the ovaries age as a woman gets older. So when you put those things together, the sort of fountain of youth is if you can do something to preserve fertility early on, such as egg freezing, you leave your options open for later. And that's where the process and the role of the fertility doctor and egg freezing comes in. So the definition of egg freezing is actually performing and doing an in vitro fertilization or IVF cycle. And what that means is that in any given month, a woman has a certain number of eggs. Normally, in the normal menstrual cycle, you only ovulate one egg per month. What IVF and egg freezing does is it manipulates the menstrual cycle. And by giving extra hormones to a woman, you can stimulate multiple eggs to grow in a 1 month cycle. Once you stimulate more than one egg, and in an ideal world, we stimulate 10, 15, 20 eggs to grow, within a 2 weeks time frame, you can go in and retrieve those eggs and freeze them. And so, like I said, it is an IVF cycle, but to take a step back from that, what we do is we bring patients in, we evaluate their fertility, we talk to them about the IVF process, and then we can move on and do an IVF cycle, which yields eggs to be frozen. And I'm sure we're going to go into more detail as to exactly how that goes, which I'm happy to discuss.
So on that note, then you're bringing in women and you're stimulating them in order for these to start the process. So who is a good candidate then for egg freezing?
Yeah, and what we've learned over the years is that the younger you are, the better your outcome will be with an egg freezing cycle. Now, typically women are coming to me anywhere between the ages of probably about 25 and up to 37, 38, even in their early 40s. But what we've learned from doing egg freezing for at least the last 10 to 15 years is that you're better off freezing healthy eggs because you're taking these wonderful, viable, good eggs, and then you're freezing them in the laboratory. So they're undergoing a treatment where they're rapidly frozen or vitrified, and then they have to be thawed later on for use. So the younger and healthier they are from the beginning, the better they'll do later on when you thaw them. So typically we say that a woman should do this under the age of 36. And if you actually look at the data and the success rates from centers who do a lot of egg freezing, we find that the younger you are, the success rates of achieving a live birth from a certain number of healthy eggs goes up. So to give you an idea, for women who do an egg freezing cycle and freeze 16 to 20 eggs under the age of 35, their chances of actually having a live birth or a healthy baby from those eggs is upwards of 70%. As you get older, the likelihood of having a baby or even two babies goes down. And that's because you might not stimulate as well. You might not make enough eggs in one cycle. And the eggs that you actually freeze might not be as healthy because they have more chromosomal errors. And so we usually say the younger, the better. Certain clinics have cutoffs as to the ages that they'll take for egg freezing. in my clinic, we don't necessarily have cutoffs. It's a personalized discussion between the doctor and the patient as to what makes the most sense, getting pregnant now, freezing eggs, freezing embryos. And so age is probably the biggest factor and the most important factor. But the other factors that come into play when we discuss who the best candidate for egg freezing is what are your future fertility plans? So in my initial consultation, I always talk to patients. Now, they might be a single woman, it might be a woman in a couple, but they're not ready to conceive yet. It could be a same-sex female. There's lots of different, combinations that come to us, and we're open to everything. And so we always discuss what your future fertility goals are. Sometimes it's a woman who was in a marriage before and had a baby, and now she's 37 and single because she's recently separated and she wants to preserve the option of having a second child. Some people say, well, I want 3 kids, but my partner isn't ready yet to have a child, so I want to retain the option. And so family planning and family building and what their goals are for childbearing are really important. We also assess comorbid conditions. So typically, a healthy patient without any other medical conditions is going to be the best candidate. We also want to make sure the patient is not taking any medication that could interfere with healthy eggs. I mean, these include certain medications like chemotherapy agents that patients are getting for cancer, other medications that can affect fertility. Typically, you don't want patients on them right at that moment, and that actually is important for those cancer patients that freeze their eggs before they start treatment. And that's where this all stemmed from, the cancer population, because we started freezing eggs before women would undergo treatments that would destroy their fertility. And from that, we've sort of extrapolated to this to just women who are interested in elective fertility preservation. So just sort of getting back to that age, comorbidities, ultimate family planning, and desire for how many kids and what your family building plan is, those are probably the 3 most important factors.
Fantastic. And I think you really kind of spoke to really what is pregnancy success. And maybe if you want to add anything on that and what.
Yeah, in terms of success rates, for sure. Like I said, the younger you are, the better you will do. But you can also circumvent and counteract age by doing more than 1 cycle. So we kind of say as fertility doctors, that sweet spot is 15 to 20 eggs. For a woman who's under 35 with good fertility levels, they might be able to achieve that 15 to 20 eggs in 1 cycle. Typically, I see that women who are sort of 35 to 38, who maybe start the egg freezing process a little later. I mean, it happens due to life circumstances, or maybe they just didn't consider it. They said, I thought I'd meet someone by now. They often have to do 2 cycles to achieve that adequate quantity of eggs. And again, that's counseling between the doctor and patient. And it's also really based on your baseline fertility testing. So the first step is always a meet and greet, a consult with the doctor. Then we bring the patient in and we do blood tests and an ultrasound to assess your fertility. And based on that, we can make a tailored plan as to how many cycles it might take and what the success rate is. So again, I go back to my statistics that if you're under 35 and you get 15 to 20 eggs, you probably can be pretty reassured that you'll get 1 baby, if not 2 babies. Once you get in that 35 to 40 range, if you can work your way up to that 15 to 28 eggs, you're probably in that range of 50 to 60% chance of 1 live birth. And then over 40, it's a lot tougher because the chromosomal errors in eggs and the genetics really come into play. So it's not that it won't work, but you have to have a lot of luck on your side and probably freeze many more eggs to find a viable embryo.
Great. Thank you, Dr. Sharma. So let's switch gears a little bit and talk about what are the costs associated to this and the costs of freezing eggs. It sounds like a pretty daunting process to some. Yeah.
And cost is a big thing that's been a really hot topic in the fertility world, especially because in Ontario, we offer, we're thankful to have patients have 1 IVF cycle that's funded. Unfortunately, as yet, that doesn't extend to elective fertility preservation. So right now, if you would like to freeze your eggs, you have to pay out of pocket. And so that price out of pocket is anywhere between $6,000 and $10,000, I would say. At our clinic, it's $7,000. And then you have to pay for the medication on top of that. Many patients, and I think insurances are really slowly coming around to the idea of covering fertility drugs in their drug plans, which is fantastic. And so the drugs are not cheap. The drugs are injections that you take every day for 10 to 12 days. And these are expensive medications. 1 cycle of egg freezing can be a $3,000 to $4,000 drug cost. And if you have to do two cycles, that's much more. So if you add on that cost, it is a $10,000 to $12,000 endeavor if you don't get any drugs back. The other thing I always mention to patients is that once you have your eggs frozen, when you want to come back and use those eggs or thaw the eggs to create embryos, that can also be a $5,000 to $10,000 process, depending on how many are thawed, how many embryos we create, and whether we genetically test those embryos or not, and as well as giving medications to the patient in preparation to actually achieve pregnancy. So it is a two-tiered cost. The great thing is that this is something that's really come to the forefront in terms of healthcare and insurance coverage. And there's a lot brewing out there about third-party payers coming into the market and starting to cover IVF and egg freezing. In fact, many tech companies, Pinterest, Google, Facebook, and some of the larger companies, even Amazon, are really taking advantage of these third-party payers that are coming into the market and are offering their employees fertility benefits and coverage for egg freezing, because that's a way of retaining their employees. And I think it's really great, because if you want a woman to come and work hard and devote her time to her job, you want her to feel secure about her fertility. And by allowing her to do an egg freezing cycle or 2 cycles that will be of less cost to her, you're going to increase her productivity and her contentment in terms of her future fertility.
Exponential.
So it's win-win, hopefully, for everyone.
Yeah, exactly. I think, maybe you can talk a little bit about, as we close up in this discussion. I think we've really kind of looked at kind of the top 5 kind of questions that a lot of women or couples have. Maybe you can speak to how long this process can potentially take for a woman or a couple.
Yeah. And I think this is a good spot to actually talk about the nitty-gritty details of what happens when you have your consult, you do your evaluations, you're on board to start an egg freezing cycle. Well, how does that go? I would say the consultation followed by the initial testing can take about 2 to 4 weeks. I mean, some patients are like, I'm doing this. They come and do their consult. They come in the next day for their blood work. They come in with their next period and start. And that's fabulous. And it's nice that we can do that and make things happen really quickly. But once you have your consult and blood test, 3, 4, 5 weeks, the process of actually doing an IVF and egg freezing, one cycle takes about 2 to 2.5 weeks. It starts with your menstruation on day 2 or 3. You take medication for about 10 to 12 days in the form of injections that go in your tummy subcutaneously. Patients are nervous, and it's with total due reason. I think I'd be nervous, and I'm in the field if someone told me to do injections for 10 to 12 days. But most patients actually, our nurses are fantastic. They actually learn really well. They're able to do the injections on their own the days they're not here. We've really streamlined our protocols to minimize the number of injections and the time. So I think we've really made a lot of progress. And so while you're taking those injections, you come in every couple of days for an evaluation to see how you're responding. And that takes place with a transvaginal ultrasound, a quick one in the morning, typically during our monitoring hours, and a blood test to see your estrogen levels to see how you're responding. We track those every couple of days. So in that 2-week window, you are busy. You're coming to the clinic every couple of days, probably 4 or 5 times for evaluation. And then when the eggs are ready at the end of the 10 to 12 day window, we say, we're going to trigger ovulation. And then 35 to 37 hours later, we do the egg retrieval, which is a procedure under sedation. You're asleep. We go through the vagina and we retrieve the eggs, no pain. And then the eggs are handed off to the laboratory. And by the next day or later that day, we find out how many are frozen. For women who want to do a second cycle sort of right away, within 2 weeks, you'll get your period and you can start again. So if you're doing 2 cycles, typically you can do that 2 weeks on, 2 weeks off, 2 weeks on, 2 weeks off within 2 months. You could take a month off in between, and then the process is all obviously a little longer. There are ways to shorten and lengthen it depending on stimulation protocols and changes that are made, but it's actually quite fast to do one cycle. You can get it done in 2 weeks. And I have patients who door to retrieval is sometimes less than 2 months, which is really great, because especially for single women or busy professional women, they don't have tons of time to devote to this. This is the reason they're doing this. So it's great that we have these protocols that make it easy for women to go ahead.
Well, it sounds incredibly well outlined, and it sounds like your practice has a very good protocol system with an incredible team. So, Dr. Sharma, thank you so much for your time today, for bringing us through this process, and we're excited to share this with our listeners.
Thank you, and I'm happy to be here. Thank you so much.
Thank you.
Take care.
Thank you.